Because rates of infections have been low for some time, and because we are all suffering from pandemic fatigue, we have tended to become complacent. We have not been as vigilant about wearing our masks all the time. We have not been avoiding crowded places, and we have been socializing a lot more. As a result, infections are surging again. The increase in daily cases is following the same trajectory or direction as it did at the start of the previous two waves. We have seen in other countries the tragic consequences of allowing the virus to spread unchecked. Cabinet has therefore decided that the country should be placed on adjusted alert level 2 with effect from tomorrow. This means that the hours of curfew will start at 11 p.m. and end at 4 a.m. It also means that non-essential establishments like restaurants, bars, and fitness centers will need to close by 10 p.m. This is to allow their employees and patrons to travel home before the start of the curfew. It also means that all gatherings will be limited to a maximum of 100 people indoors and 250 people outdoors. Where the venue is too small to accommodate these numbers with appropriate social distancing, then no more than 50% of the capacity of the venue may be used. This includes religious services, political events and social gatherings, as well as restaurants, bars, taverns, and similar places. We have embarked on the biggest mass vaccination program in our country's history. 2 weeks ago, we started the second phase of the vaccination program, targeting the balance of our health workers who had not yet been vaccinated during the first phase, and all of those in the country who are over 60 years of age. This follows the first phase of the program, in which nearly 480,000 health workers were vaccinated. More than 67% of public health workers have been vaccinated. Over the last 2 weeks, over 480,000 people have received the first dose of the Pfizer vaccine as part of the public vaccination campaign. Because the Pfizer vaccine requires 2 doses to provide maximum immunity, these people will need to have second dose 42 days after their first dose. In total, over 960,000 people in South Africa have received 1 vaccine dose. Within the next few weeks, or days rather, within the next few days, we will have administered vaccine doses to more than 1 million of the most vulnerable South Africans. Several important measures remain in place. It remains mandatory, that is compulsory, for every person to wear a face mask